Started now. Good afternoon and welcome to Total Rewards Association of South Florida's webinar. I'm Giovanna Flori, President of TRAS, short for Total Rewards Association of South Florida. Today, 30 years later, TRAS continues to be the premier organization in South Florida in the field of total rewards. For those of you joining us this afternoon and who are new to TRAS, we are a local association of World at Work, the national association that offers HR professional development certification programs, conferences, and the opportunity to network. So please consider joining our association by visiting our website at tras.org. So today we're pleased to present Totem, a benefits consulting firm, who will share with us how they help their clients simplify healthcare, get employees to the best care and lower health plan costs. I know that a lot of people just struggle with that and have many challenges. So you'll hear from Jeff Rosen, Senior Vice President of Sales and Finance, and Annette Griffin, Vice President of Business Development. Both Annette and Jeff are certified Health Rosetta Benefits advisors committed to an industry-leading standard of transparency and fiduciary responsibility. They both use data analytics and proven practices. They design health plans that can reduce healthcare spending by 20% or more. That's great. While achieving better healthy outcomes. That's very important. So welcome, Jeff and Annette. Before we get started, I'd like to ask everyone to please add any questions you have in the chat section. We will address them during the presentation and at the end. So don't be shy. Please feel free to ask your questions. And with that, I'd like to introduce Annette and Jeff. Thank you so much for joining us today. We're really excited to hear from you.
Well, thanks, Giovanna. We're happy to be here and we're happy to support TRAS and to be here with you all. Some of you know us, but for those that don't, I'm going to do a really quick intro of Totem Solutions. So we're a benefits consulting firm, but we like to say that we do much more than benefits consulting. Our mantra is be there for everyone. So we help organizations to be there for everyone in their company, from the employees through our year-round employee support to our comprehensive benefits administration, really relieving that burden for the HR group. We manage all aspects of benefits administration for our customers, but most of all, as Giovanna said, we really like to solve problems, and one of the biggest challenges today is healthcare. So when we think about healthcare and how to improve it, we really have to acknowledge that there's three fundamental problems with employer-sponsored healthcare. And we call these the three villains of healthcare. So they are utilization, quality, and price. And in terms of utilization, 30 to 40% of all care is unnecessary and clinically inappropriate. And that number is even higher for specific procedures. Only a third of members are visiting the best quality providers in terms of quality. And the PPO networks today don't steer to high quality. There's a tremendous variation of cost and quality within that same PPO network. And high quality providers not only have better outcomes, but they perform less procedures per patient overall. And we all know the cost problem. Healthcare has outpaced inflation by more than any other industry. And had it tracked with inflation, consumers would have a lot of extra money in their pocket to spend on other things. And we really can't continue to increase the deductibles to manage the premiums. We're at a tipping point with healthcare. This slide really speaks to the overutilization and quality problems. This is data from Edison Healthcare, which is one of our recommended Centers of Excellence programs. And you can see here, it's pretty startling data. So if an employee is sent to Edison Center of Excellence for spine surgery, 55% of those employees are turned away. They are given another treatment plan. They don't need that surgery, and the best physicians in the country have recommended a different treatment plan. So you can really see how if the employees weren't going to that center of excellence, that contributes to that overutilization problem. The misdiagnosis rate with Edison Health is 30% for cancer, and that includes many procedures that also includes people diagnosed with cancer at their home state that go to a centers of excellence, and it turns out they don't have cancer. This is last year's facility data from one of our clients. They have about 1,000 employees and they're located in Metro Atlanta. And it's really a scatter plot of quality and cost data. It speaks to the fact that if employees don't know which hospitals to go to in terms of quality and cost, they're not going to maximize that opportunity. So the #1 hospital with this group, the most highly utilized hospital, has an overall quality rating in the middle level, but they're pretty expensive. The most highest quality rating hospital that's the least expensive is actually #7 in utilization. So really good opportunity to educate consumers about quality to get them to better care. There's really numerous solutions in the marketplace today. Jeff and I are Health Rosetta advisors, like Giovanna mentioned, and we're committed to changing the status quo of healthcare with the focus of quality at the core of our recommendations. So if we do this, if we focus on quality, the savings will happen. And our strategies, we call our healthcare strategy Totem Health, and our strategies are resulting in 20% to 40 or even 50% savings for our customers. We have 50 employees at Totem, and we actually implemented this exact healthcare strategy for our own employees. SimplePay Health, along with the Edison Health Center of Excellence model and direct primary care. The direct primary care is on-site and virtual. Direct primary care can avoid up to 90% of specialist visits, really focusing on appropriate care and holistic health. And with the DPC experience that we've had, we have several employees that have been taking less or no medications, including myself. So it really does focus on holistic care. And during this time of COVID, it's very convenient because there's that virtual piece, the virtual piece where you're in ongoing communication with your physician. We also highly recommend including a Center of Excellence program. And like I said, our recommended COE program is Edison Health. And basically, the plan provides 100% coverage for these conditions. It's for cancer, orthopedic surgery, transplant, cardiac, and a few other conditions. The members pay nothing. They pay zero to go to the best facilities in the country for these conditions. And we call our strategy Totem Health, and this is what we've implemented, like I said, for our own employees. So we really do believe that this works. And here's why we like SimplePay. In addition to the phenomenal member experience and easy plan design, it's really an integrated solution. It's an integrated model. So the focus on high quality steerage is at the forefront. The model is based on quality and navigating employees and their dependents to high quality providers. The network is the Aetna National Network. There's also a transparent PBM, it's Med1, and the user experience with the PBM is just like healthcare, with easy tools to determine the best price for these medications, which we'll talk about. And the savings on pharmacy is a huge opportunity. The program also includes concierge medical advocacy, and that is white glove customer service through a dedicated health pro. So different than calling, the huge customer service, this is a dedicated health pro that you're going to speak to the same person every time you call. That health pro helps you to find physicians, make appointments, answer questions. There's also 8 to 10 integrated wellness programs to really get that member the best health possible. There's the Red Brick Wellness Program, there's solutions for mental health, for diabetes, and more. And then last, the easy member billing. So gone are EOBs and multiple bills from providers. And basically the members receive one SimplePay statement each month with the amounts due from the copays. So completely different approach, bundled solution, integrated solutions. So let's talk about why and how SimplePay was developed. The founders of SimplePay have spent their careers focusing on getting patients to the best providers with the best outcomes, fewer infection rates, less readmissions, really reducing the total episode cost. Scott Shainvogel is one of the founders, and he was the CEO and founder of the country's largest navigation platform, Compass Health. So he really helped navigate consumers through this complex maze of healthcare for many, many years. And it wasn't until a few years ago that the data became available that they could look across the entire universe of providers and look at every doctor, every hospital, every ancillary provider, and leverage one of the largest data sets, which consists of 130 million patients and 30 billion claim records. So this data set, this platform of data that they're using to identify the quality providers is huge. And it became very clear to the founders that there's a difference in quality that results in an average savings of $5,000 per patient to the employer. So when a patient goes to a high quality provider, those patients on average, the cost of care is $5,000 less per patient per year. There's less complications, they heal quicker, and that's a great savings opportunity for the employer. I think everybody would agree that healthcare is very complex, and when we talk about the consumer experience, consumers really prefer simplicity. The global brand Simplicity Index ranks healthcare as the bottom ranking, number 25. So this just goes to show, that we really do have some work to do with the healthcare industry and simplifying it and making it like other consumer experiences. Today's PPO networks have a wide range of quality and price from provider to provider. The doctors are not incented based on quality. The reimbursements rates are really based on these very complex network contracts. They're not tied to quality in any way. So the typical plan design does not include any incentives for consumerisms. And patients are generally financially indifferent when they're choosing a doctor because they have the same deductible, they have the same copay, regardless of the provider. They're using, of course, looking at an in-network provider, but beyond that, there's really no incentive for them to engage in a high-quality provider with the current healthcare plans. The SimplePay plan includes a financial plan design incentive for the patients to get higher quality care and for the employers to capture that $5,000 per patient per year opportunity. And, over the last 10 years, the industry has moved large numbers of members into high deductible health plans in hopes that consumerism would take hold. And even though these plans do include some incentive to go to the best doctor because they're taking that first, high deductible before the plan pays anything, it was just too complicated. Only 4% of insureds can accurately define what a deductible and a coinsurance is. And, when the multiple bills came in from the providers, it got more complex. So I think, that one of the problems is that it's a kind of a good problem, but people aren't using insurance, enough to get really good at it and to really understand the current model. So with SimplePay, members are always able to access quality as easily as they do for anything that they buy today. So you'll see they're able to quickly evaluate providers. They're able to understand their out-of-pocket cost upfront for every medical and pharmacy item, and they're able to compare costs very easily and quickly so that they're able to choose, a more cost-effective option. And along the way, SimplePay has eliminated these multiple bills from providers, and there's no EOB. There's one monthly statement that the employee pays, and it includes the copays that are due. So different program, very simple, And it makes a lot of sense when we think about the way that we purchase other goods and services. That's really how SimplePay developed this model. So the process works the same way as purchasing a TV. And this is in no way to suggest that a television purchase is anywhere near as important as healthcare, but the process works the same way. And when the developers were creating SimplePay, they looked to these consumer experiences and really modeled the program off of those. So for most people, you know, purchasing a good or service starts on the internet. You compare prices, you look at the reviews, you look at consumer reports, and you understand what your cost is going to be. So you choose your cost, you go into the retailer. At the retailer, you pay with your card. You never have to worry about getting bills later from additional, you know, from the manufacturer, for example. You never have to worry about the retailer billing for some of the cost and getting the rest from the credit card company. And that's really what we have today in healthcare. So if we take an example of a member needing a medically necessary knee surgery, in terms of network and choice, SimplePay is not narrowing the network. It's based on the Aetna National Network. SimplePay is looking at the entire universe of providers, and they're identifying where the best care can be delivered. They're looking back at that data set, and you know, the best knee hospital may not be the best place to have hip surgery, for example. So all of this data is accumulated and looked at. Algorithms are run so that they're able to identify the best providers and facilities for that specific procedure. So from a member experience, you know, the member needs knee surgery. They can either engage with their mobile app with the platform or with the Health Pro telephonically. Very easy. Nobody needs to go to open enrollment meetings to understand the green, yellow, red, to understand, you know, very simplistic out-of-pocket costs that are displayed. They've designed price tags for virtually every healthcare and pharmacy service and event. And for example, the top tier provider for this procedure, the copay for the member is $750. There's no deductibles, there's no coinsurance. Everything has one flat dollar amount. They're copays. The copays are used to create the incentive for the patient to go to the highest quality providers. And every time the patient does this, that employer is saving that $5,000 per patient per year. So again, this information is available through the mobile app or through the dedicated Health Pro on the phone. And with one click, members can easily see and compare the providers in more detail. The SimplePay platform is super easy for the members to see which providers are better. We love it. It's very user-friendly. In this example, the provider on the right has higher rates of acquired infections. You can see the out-of-pocket costs are displayed for both here. You know, 5 stars is better than 3 stars. The tool highlights the number of stars, the out-of-pockets, quick and easy way for the members to get more information. So with the knee surgery example, the providers are part of the Aetna network, but there's 2 important changes that make it simple. We already alluded to this, but if you look to the right, the member responsibility is a flat dollar amount. There's no more deductibles or coinsurance. So what SimplePay has done is they've created the out-of-pocket actuarial value for that episode of care. The patient never has to wonder, you know, what will they owe in addition? They know up front what they will pay. Even if there's a complication, the member will only pay the $750 in that case. The second thing they do is that they don't require the providers to collect the copay from the patient. So if we think about the TV example, when I buy a TV from the retailer and I use my bank card, the retailer is always paid by the bank in full. They don't get some of the money from this consumer and the rest from the bank. Then the bank sends one monthly statement to the consumer, and that's what SimplePay is doing. And at the point of service, the members show their ID card. The ID card is, of course, the Aetna national brand. The claims are submitted to Aetna like usual, and the providers are paid at that Aetna contracted rate. And just remember, if anyone has questions, just a quick reminder, I'm kind of going through this pretty quickly. If anybody has questions, remember to put those in the chat box. So instead of the patient getting EOBs and multiple bills, they get one medical statement that summarizes the copays from the last 30 days. So the plan design, members are responsible for copays only. And again, those copays are derived from the actuarial value from that episode of care. The monthly statement is from SimplePay. The members pay SimplePay monthly. They can pay by check, they can pay on the mobile app, or they can do auto pay through the platform. They can pay the balance in full. This is really exciting too. This is a huge differentiator. Many employees don't have, in this example, the $750, to pay that copay in full. And SimplePay felt it was really important to include a zero interest credit option. So employees can pay the balance in full, or they can pay it over time at 0% interest rate. It's huge. So they've really addressed that piece as well, making it very employee friendly. And something else I think to mention is that, when an employee chooses a high value provider, a high quality provider, with this new copay structure, they're going to pay less than what they used to pay. They're going to be incented not only when they look at tier 1 versus tiers 2 and 3, but generally speaking, they're going to pay less with this new tier 1 copay than they're paying today with their current deductible. And, providers are happy about this.
Annette,
yep.
Annette, hi, this is Giovanna. I just wanted to stop you there. I don't know if we have any questions, but I have, if you could just explain this monthly statement again. Just go a little slower with it, because I don't know about anybody else. I'm just trying to digest some of this.
Sure. So basically, when the employee goes to the doctor, they're not paying the provider. They're not paying the provider at the point of service. So the employee receives a statement every month. The employees pay SimplePay for their copays on a monthly basis. The providers don't collect money from the employees. The providers are paid in full by the plan, by the TPA. So, the providers are submitting claims just like any other network, Aetna network, self-funded plan, but they're just not collecting the employee portion at the point of service. They're paid by, they're reimbursed by Aetna. They're reimbursed at those contracted rates by Aetna. So it's different, but it's easy because the employees don't have to, as bills come in and figure out, in this example, for example, you've got the anesthesiologist and the surgeon and you've got the facility. And today, it all depends on when that claim is processed. So if the anesthesiology claim is processed, if that hits first, then that's, that member is going to pay that anesthesiologist their deductible. It's no longer the case. The providers don't bill the members. SimplePay is paying the providers. Did that help? It's definitely a shift.
If anyone has questions, please put them in the chat section, or if anyone needs clarity on anything. Otherwise, we'll just move to the next slide. That's great. Thank you, Annette.
Yeah, it's a self-funded plan. You've got the TPA, that's managing. None of that is different. The only piece, that's different really is that employee-facing piece where they're not paying the providers anything. And it's, again, the whole premise is I know exactly what I owe up front and before I get that care. And really, providers are happy because they're not having to collect money from the patients. They're getting paid that portion from SimplePay, from the TPA. Hopefully that helps. All right, so let's talk a little bit about the plan design. So SimplePay calculates the actuarial value of the existing plan design. So they're going to take your PPO plan and look at the different benefits, the deductible, the coinsurance, the out-of-pocket, all those different provisions in the plan. And they calculate the actuarial value. And then they're going to substitute the deductible and coinsurance with that variable copay structure. So this is a summary of kind of a standard SimplePay plan where you have the tier 1, 2, and 3. So tier 1 is the highest quality. The members are paying less for tier 1. They're paying more for tier 3. The plans still have an out-of-pocket maximum, and they're ACA compliant, so none of that changes. Of course, preventive care is covered 100%. So SimplePay is really looking at those patterns and claims, and they become very predictable because they have so much data that helps them. You know, if an oncologist admits to facilities where there's more readmissions or where there's some concerns, it's reflected in their tier. And generally, the savings for employers with the SimplePay plan is at or above 20% on the medical. But the other thing is, you know, the patients really do save money too. So, you know, as an example, we implemented this for our own employees. So we have the SimplePay plan. We really believe in it, and it's great. It's working out wonderfully. But what we did is we actually included greater steerage between tier 1 and tier 3. So you as the employer can work with SimplePay and with us to determine, you know, what is the appropriate steerage for you. So as an example, for primary care physicians, tier 1 for us is $15 and tier 3 is $95. So you can create as much steerage between these as you see appropriate. Of course, the greater the steerage, the higher the potential level for financial savings. And there really has not been a better opportunity to save money on prescription drugs. So the prescription drug experience with SimplePay is really designed to work the same way as the medical, where the employees can quickly and easily see their out-of-pocket costs before they go, and it'll give tiers 1, 2, and 3. So for example, Lipitor is $400, you know, at one pharmacy, and at another one, it's $220. So it all depends on that contracted rate. And it varies significantly between these pharmacies. Today, there's really not a lot of motivation to purchase a prescription at one pharmacy versus another. But by setting the lower copay, it allows the patients to save money and to fill that prescription at the location with the best contracted rate. And with the SimplePay model, the spread is also retained by the employer. So it's not being retained by the PBM. And where SimplePay is seeing double-digit savings on medical, it's even higher on pharmacy. SimplePay has combined the easy plan design with a white glove concierge approach to serve the members. Members don't have to speak to a customer service rep that doesn't know them. They have a dedicated health pro. So they have one person that they speak with, and that's a consistent health pro while they're insured. The health pro can schedule appointments with providers. They can answer questions, deal with billing issues, but most importantly, the members get connected to the highest quality providers really with that health pro. The health pros can also engage the clinical experts at the beginning of the care episode. So when a member contacts the health pro to learn more about where do they go for a procedure, the health pros are really good about engaging the clinical team at that time as needed. So that health pro and the clinical experts at SimplePay really work together for the members. And the SimplePay technology, you've seen some pictures of the mobile app. It's super intuitive. There's a platform as well, so you can do this, of course, from your laptop, from your computer. Members can search for providers. They can pay their monthly bill, or they can auto pay it. Ask questions also with live support. Members can also get connected to the clinical programs to help them live a healthier life. SimplePay has several embedded clinical programs. For example, Regenex is stem cell therapy, and that's an alternative to surgery. There's things like Naturally Slim. There's a mental health program called Joyages. And then the Red Brick Health is the wellness platform that's also integrated. So, you know, in summary, SimplePay really has a comprehensive solution with a different plan design. It's copays only. It's a great member experience. They've gotten rid of EOBs and multiple bills from providers. And then there's some powerful integrated features as well. And that kind of gives you a look at SimplePay. It wraps up the presentation that I had planned. So I think now might be a good time to talk through additional questions, to go through, you know, anything else as we see, any other questions that we have so far.
I'll give you a question. You said that was with the SimplePay is with the Aetna network. Is it available to other networks?
Yes. So, and Jeff, you can jump on as well and supplement and take over if needed. But it is, so generally speaking, Aetna is the national network. But depending on the locations, the specific locations, if you have certain employees in an area, they are able to put in wrap networks as well to supplement. But generally speaking, it is the Aetna network for the bulk of the members.
And that's right. It's not quite an open network where you can go to any non-credentialed provider, but the employer can set up direct contracts. That's something that we've done ourselves. And then you can also easily add an out-of-network provider. So for example, as long as the member is proactive and speaking with the health pro, their concierge, so let's say their specialist isn't contracted with Aetna, the health pro will then bring them in and at the appropriate tier based on their underlying quality ranking as well.
Thank you, Jeff. Anyone else have any questions to that? I know here in Florida, you know, the Blues are pretty big. So we do have, you know, the pretty big presence there. Cigna, United Healthcare, Humana.
Mm-hmm.
Yes. A question I have is the monthly statement, is that sufficient documentation for reimbursement under FSA programs?
Yes, it's a little bit different, so it will require perhaps some coordination with the vendor, but we haven't seen any issues there so far. And you can also pay the bill with the actual card itself.
Part of the reason why I ask is you indicate that there's no EOBs, and quite often that's the documentation that the FSA administrator is looking for.
Right.
And I may have missed this, so I apologize. Is this program an bolt-on by the employer or something the employee/participant could elect to utilize independently of the employer?
It's only available through the employer. Some employers have put in dual option plans, but and I think that makes sense once you're bigger, maybe let's say over 10,000 lives, but under that, it seems you're basically doubling your work, and it's less efficient to do it that way.
Thank you.
And it generally works like other self-funded employer plans as well. So, you know, working with SimplePay, with stop loss, but it's all integrated within SimplePay.
I think that was good. We can move on. If anyone else has questions, just put them in the chat section as well, and we can address them. Thanks, Annette.
Sure.
Actually, Annette, I put some questions into you privately. We can look at them there.
Was that David?
Yeah.
Yeah,
Okay.
so the TPA maintains the typical TPA role that they would do in terms of other self-funded health plans where they're paying the claims. And, you know, the employer.
Annette, I'm sorry, Annette, could you share the question that David sent privately, because the group didn't get to see the question or hear the question?
Sure. I think just, you know, talking through the third-party administrator role with SimplePay. It's actually Aetna Meritain. So it's a similar role as any other TPA in a self-funded health plan. So the TPAs are paying the claims, and you know, the providers are basically billing once they've seen the member, and the TPAs are paying the claims. And the minimum number of lives you can offer this program to, I believe SimplePay goes below 50 or at around 50, but Jeff, you might know that answer, the minimum number of employee lives.
Yeah, right now, their position is that they'll go as small as you can get the reinsurance configured for. And so and what we've seen is that's about 20 lives, 20 employee lives on the health plan is enough to be self-funded and put in SimplePay.
And we had another question relative to specialized networks. And Jeff alluded to this, but I think just to kind of expand on it. So you do have the ability to add networks and to add specific providers if needed, but that's kind of on a case-by-case basis with SimplePay. So they're very flexible with that. You know, we bolted on some local chiropractic care providers here. We also have a direct primary care provider that we've included in the program. So there is flexibility with providers. And again, in terms of networks, they do have the ability to fill in certain areas, you know, as a quote wrap network would for, you know, certain areas where the Aetna network might be a little deficient.
And Ed, this is David. Quick question on direct primary care. Are you capitating the PCPs, or is it going to be still based on a discounted fee-for-service model?
So our direct primary care program that we use is a capitated model, and it's outside of our self-funded health plan. So it's a, you know, per member per month cost.
Okay. And what's the maximum number of members on that panel so they get quality care? How do you work on that number? Where do you peg it at?
So the maximum number of patients that our DPC works with. Jeff, did you want to take that one?
Yeah, I'd say it varies depending on the team approach. We like to see somewhere in the 600 member per MD range. I think that's an important metric to look at, but you also need to be looking at outcomes. You know, are we getting good engagement with the members? Are they having good experiences? Are specialty referrals, ER visits, urgent care, are they declining? So that is one important piece, right?
Okay, and a second question on inpatient hospital care. How are you paying the providers? Is it on a per diem basis? Is it on a percentage of savings? How does that work?
Right now, it's at their standard Aetna contracted rate.
Okay. So basically, the way in which you anticipate saving money is directing patients to more efficient providers, not necessarily based on what the providers are currently being reimbursed. Is that it?
Yeah, I'd say quality is paramount. So there's about a 19-point algorithm that looks at all the providers and facilities, and really cost is at the end. And what we've seen is that if you look at a plan and say, what's the difference between a member that has an expensive episode of care and one that has an inexpensive episode of care? It really is just about quality, because the quality providers, they're not always lowest on unit cost, but they're pretty close because they are more efficient. They're spending less time in the OR, but then they also do less care because they're practicing within their normal practice patterns for their specialty. And there's less downstream costs from readmissions and infections and redos and all those things. And so, yes, it is about quality. And in terms of the savings, their numbers from last year were pretty powerful. We had been talking about reference-based pricing like a lot of benefits consultants. And, the reality is there are savings, but there's a trade-off for that disruption and member experience and all that. And what SimplePay found is that if they could put in a plan design and communicate a plan design, they could get 50% of members to go to tier 1 providers, which we think is very realistic. That their paid claims were coming in at 177% of Medicare, which is fantastic. And so a program like SimplePay that really has minimal, if any, disruption, we think it's more upside for the employee to come in close to the net savings on an RBP plan when you add in all the administrative fees is quite powerful. And as Annette alluded to earlier, for our own plan and the plans that we're implementing, we're cranking up that steerage more so than a standard SimplePay plan, trying to increase that spread between tier 1 and tier 3 so that we can hopefully get more like 75% of members going to tier 1 providers.
Thank you.
So here's another question. Is the employer getting their own reinsurance? Yes. Or, the SimplePay can do it kind of like other TPAs work where, you can have the TPA market the reinsurance, or you can go directly to the reinsurance market. Any other questions on that? That was from Manny.
And then this is David again. Are you finding any uptick in direct contracts with hospitals? So not just a network, but an employer saying, we want to have, maybe 2 or 3 hospitals and negotiate directly with them. And are there any potential savings for large employers that way that you're finding?
I think generally there are savings for direct contracting outside of SimplePay. And that's absolutely part of a conversation that we have in terms of a multi-year strategy, working with the employer to develop the right strategy. And depending on, demographics and other factors, that's something, that is absolutely a good opportunity. Within SimplePay, I'm not sure if SimplePay has integrated direct contracts. We can check with them and note that as a follow-up. Jeff might know the answer.
I would say that generally speaking, it hasn't really been needed yet. What we've seen is that most metro areas are going to have maybe 1 or 2 tier 1 hospitals. Sure, there's some variation by specialty and things like that, but 80% of the time, a great hospital is a great hospital, and that that those high quality facilities are actually already at a pretty aggressive reimbursement rate. Sure, so for example, in you know, in Atlanta, tier 1 hospital is Northside. Sure, maybe we can get a few points on the Aetna contracted rates by going direct to them, but Northside doesn't actually direct contract with employers anymore. So that's you know, you're going to run into a few things like that. But I would just say, generally speaking, the savings are sufficient enough that you don't really have to do that.
Okay.
So I have another question. Alex asked, is everyone approved for the 0%? So for the credit, zero interest credit. And yes, they are. So during the proposal process, part of the process is to look at the demographics of the group, which also includes salaries. And SimplePay basically includes those fees in the administrative fee. So everyone's included for the 0%. There's actually a slight fee in the admin fee for that 0% credit for the employee. Interest-free credit. Does that help on that one?
Mm-hmm. Yeah. Have you found a wide variance in terms of the PEPM on employee sizes in terms of, say, you know, under 100 lives compared to maybe over 500? Does that impact the PEPM considerably or not?
I have not seen a wide variation.
Yeah, they've just, for now, they've chosen to approach the market charging essentially everyone about the same.
Okay.
And there is the variation in the PEPM has to do with the perceived risk, potential risk of an employee basically leaving and not being able to afford that copay. And so as Annette alluded to, that's part of the proposal preparation process, is looking at your average income relative to the actuarial value of your plan, and then bump that up against the average income of the employee. Or sorry, the average turnover of the population.
How much lead time do you need to get something like this implemented? 6 months or so?
We are looking at about 90 days, which is standard for a new self-funded plan implementation.
Okay, because there's quite an educational process that you have to communicate to. So that takes a bit of time to roll that out to the employees. Okay, that's interesting. Thank you.
You know, we weren't sure how our employees were going to receive it. We did, you know, a 40-minute Zoom call like this, and had one or two people that were kind of confused about the prescription piece, why you pay less when you don't go to CVS or Walgreens, basically, and one or two people that had some questions about the DPC piece. But overall, we found it to be fairly easy. Only 4% of people understand deductible and co-insurance anyways, and all you say is, hey, you know, you have three options, and the cheapest one for you is the best quality. And by the way, you have no deductible, no co-insurance, and it's been received very well so far.
Okay, thank you.
So how, you just mentioned CVS and Walgreens. How does the pharmacy piece work? Or they have to go through the PBM?
So if you choose to use the integrated PBM, which is MedOne, you don't have to, you can certainly bring your own. Then they allow you, so traditionally to reduce drug costs, employers have said, let's just exclude CVS or exclude Walgreens, and that's going to lower our acquisition costs from the pharmacy. And you can certainly do that, but what SimplePay allows you to do is say, okay, my generic preferred copay is tier 1 is $5, and that's literally any pharmacy except CVS and Walgreens. My tier 2 is $20, and that's CVS, and my tier 3 is $35, and that's Walgreens. So you're not taking away choice, but you are giving the member an option where what the plan pays correlates with what their copay is.
Okay.
Got it. Great. I'm like, I think what David said earlier is about how, you know, it's communicated, because education and communication is everything, and how it's received by your employees. And it sounds like, you know, everyone has embraced it and there hasn't been any challenges. Because that was going to be one of my questions, of what are some of the challenges that you see? And what I love is, you know, the balance billing. You're not seeing any of this balance billing and surprise billing. We deal with this constantly in the way the healthcare system is designed from a fully insured plan, you know, perspective.
Balance billing happens.
I'm fully insured. What's that?
Balance billing happens on a traditional PPO plan. You know, we see this all the time with the hospitals in Atlanta. When you have a baby, you have a high deductible, you got to pay the OBGYN a deposit on your deductible. And then let's say your deductible's $6,000, so you pay them $3,000. And then you have the baby, the facility bills before the provider, and they want the full deductible. And they call you every couple of days until they get it, because they won't coordinate with their contracted in-network, you know, same brand name provider. So that's just a major issue within an existing PPO network. And in terms of disruption, you know, I think my situation is probably as disruptive as it gets. We implemented the 6-1 and found out a few weeks earlier that we were having our third child was on the way, and the hospital where we had our first two was actually tier 3. And because we had a big spread, you know, we had the option. We could pay $6,000 to go to the prior hospital, or we could pay $1,000 to go to Northside, which is tier 1. And so worked through that, and you know, that's the benefit of having that concierge that helps you find a provider and explains everything. And you know, it was something that we had to work, that my wife and I had to work through, but ultimately she's happy, we save money, and the plan saves money in the long run. And hopefully we get better care there too.
Great. So
we
I think we're about wrapping up.
I didn't get to. I don't know if we have time for it. We have one more question that I didn't get to that I can answer real quick. So Manny asked, who deals with the receivables for employees? SimplePay deals with the receivables, collecting the copay, the monthly statement. They manage all of that. So the employer does not do that.
Well, that relieves the administrative burden of the employer. So HR likes that. That's great. So we have just a few more minutes. We're just about to end. I'd like to just spend a little time sharing with everyone on the call how they can get in touch with you, Annette and Jeff, if they're interested in learning more about SimplePay and some of the work that you do. And we certainly at Trust thank you for supporting us and appreciate your sponsorship. This is really good education.
Sure. We're happy to speak with you individually with follow-up questions. And we can be reached, basically, it's our first name at totemsolutions.com for our email. So for me, it's Annette, ANNETTE at totemsolutions.com. And same for Jeff, GEOFF at totemsolutions.com. Or certainly, you know, reach out to Giovanna. We can get in touch that way. So,
and one thing I'll add.
And can everyone reach you at LinkedIn as well?
Absolutely.
Just one thing before we go. I know that your group is kind of a mix of employers and other benefits consultants, but we were early adopters with SimplePay, and have committed to help SimplePay get the word out. And so if you are a consultant and would like to learn more, we are happy to share information with you and help you get started.
Thanks, Jeff.
Right,
that's helpful. I know you guys are, I said in your information you provided that you're a proprietary partner with SimplePay. Do they work with other brokers and partners and consultants, or is it proprietary to just a few? How are they doing? How are they expanding that relationship?
It's not exclusive, but it's limited.
Got it. Okay. Great. Well, thank you so much. We enjoyed spending this hour with you, and look forward to hearing more from you guys.
Yeah, excellent presentation. Thank you.
Thank you all. Hope you guys stay well, and please do reach out if we can be of any assistance.
Thanks, Annette.
Thank you.
Thanks so much.